write it in the chat. Thank you.
Okay. Karun, go ahead and talk about the program. I'm not sure what you were. Oh,
Yeah.
Yeah.
Yeah, I was hoping if you could just give a quick introduction to our program. You know, we might be having a lot of new members. So.
Oh, okay. So for those of you who are new, we've been doing this for about a couple of months. Basically, what this is a group that basically is either training people to be contact tracer or going to become contact tracers. Contact tracing is the closest thing to a vaccine. High volume testing and contact tracing are almost as good as a vaccine in controlling the spread of COVID-19. So this is why it's important. We currently have 300 people, like I said, that are already past the AASHTO course and have been going through various degrees of training, both mock interviews and other type of interviews. And so that's where we're at now. And we're now going to start assigning clients to those people. And so the purpose of our calls are basically to, number one, teach them about COVID-19 and about how to prevent the spread. Number two, going to help them start putting together their list of contacts, and so that we can help them contact them. It's possible that they may also get a call from the state for the same thing, but if anything, it'll speed up that process and allow the people that work for the state to actually move on to the next member, because hopefully our people will have everything already written down and ready to go, and we would have helped contact people. Obviously, time is of the essence. So as you saw from the survey, most of the reports are showing that people were contacted, 7 days or later, or were never contacted. Obviously, once 14 days goes by, you've lost a lot of opportunity, because not only does the recollection get worse, but also not reaching people on time then allows for more spread of the disease. So this is the most important team that we have, because we're basically the team that is going to help keep everything open and not have to go back to closing everything down again, because this is what you need. You need testing, and you need a lot of contact tracing. I think I'll turn it over now to Virginia and John.
Okay. Hi again, everybody. Under Dr. Michelle's tutelage, we have 4 administrators, myself, John Van Keppel. You want to wave, John, so people see you or say hello? Obi, I can't see what page you're on. You want to say hi?
I was muted. Everyone. Hi, everybody.
Obi, do it again, please.
Oh, okay. Hi, everyone. This is Obi.
Okay. And Sean?
Hello, Sean.
Great. Thank you. So we've been working hard, as the doctor said, for probably almost 2 months now, trying to put together something from nothing. And so for those of you who are new, we have a lot of people who have done this from the beginning, and so we're working through the process. An app has been developed, a web page has been developed, and training is being done. Today is our launch day, and the app is this close. So we can't assign anyone yet until the app is finished. And we're working on that this afternoon. And then the PUIs, the persons under investigation, the names will come in, and I'm going to be assigning them to, right now we have, I think, 14 volunteers who have gone through to the CTS approval process. And in your welcome packet, you've got the list of criteria to become a CTS approved caller. And so those will be distributed as soon as the app is ready, and then we can begin to actually start the process that we've been developing over 2 months and see how it works, and hopefully it's going to go smoothly. A lot of our volunteers have been practicing with it, have been testing it, have been working with it, have been working with each other. So we've been able to identify things that needed improvement and things that needed to be added, things that needed to be taken out. And so we're still in that process, but hopefully we're close to being able to make the first phone calls. So for those of you who have been or almost through the process and have been practicing, we encourage you to keep practicing the interviews and then the mock interviews. So we're calling it, let me go through the process real quick. So you sign up, right? You take the course. You have one of two courses you take, either the ASCO or the Johns Hopkins. You sign a non-disclosure agreement. And that's when you upload you get your certificate from the course, you get your certificate of non-disclosure, and your ID can be uploaded at the same time. All the instructions are in a user guide, and there's an orientation video on the website, the volunteer.larkinhospital.com website. Once you have completed all of that by reviewing the materials, excuse me, then you'll start practicing the interviews. And we're learning that practice is important and necessary in order to test yourself with the app and with a person on the phone. And so the more times you can practice that, the better and the more comfortable you'll become. We want you confident. We want this to be fun for you. And so the more comfortable you get with it, the more fun you will have with it. So you'll go through your region heads and you'll go through training for the interviews. And then your final interview is called a mock interview, where it will actually be recorded, either audio or video. You'll hold up your picture of ID so that we can verify that it is in fact you. And you will have finished the process to go from volunteer to CTS, and you'll be an approved CTS, and we're keeping track of those. The user guide goes through all of this, and then it takes you through how to connect with the PUI and the step by step. So it really requires you to use the guide, the app, and go through the process and understand it. So we're hopeful that today, tomorrow morning, we're going to be assigning the first PUIs out, and we'll be able to test everything that we've been doing. You guys will continue in your practice runs, and all of this is going to merge into the fruition of this project that we've been working on for so long. And it really will help as people get the word out that in order to stop the spread of this, you've got to identify where you've been and who you've been with, and you've got to self-quarantine, and hopefully this will keep people from getting sicker. John or Sean or Obi, any of you have anything to add?
Yeah, just so for those of you who've been here for so long and you've been able to weather all of the small changes and some big changes, and that you have already, some of you have already done the mock interview. We've just asked that we put a hold on the final mock interview for a couple of reasons. One, believe it or not, there's still some tweaks that we're doing on the app. One of the things that we have learned both through practice and from some of the interviews is it's really not necessary to ask who their personal healthcare provider is, because that takes too long on the interview. It's also a personal question. We don't really do anything with that information, so we're taking that off of the app. We are adding a question. When in the introduction, we ask, has the health department been in touch with you? So just there's a little button on there, yes, no. So we can keep track of who's been contacted and who hasn't been contacted. And then for general knowledge, but also it's part of our own quality assurance, there is going to be a questionnaire at the end of the app that you will send out to them, that you ask. They do it on their own. It's not something that, it's not really evaluative of you, but it's trying to get information from them. So we're making these little changes. So for that reason, we ask that you wait to do your mock interview. And then secondly, we have had a great team that has stepped up to the plate last week to help us start doing the mock interviews. And what we've realized is that in many ways, we want to do a mock interview. We want to do more of a training process for the interview so that it's very instructive, so that when you are doing your interview, you really have somebody who can give some feedback on things that you're doing well and things that maybe you need a little help on. So we're working, starting a team of trainers to put that together this afternoon after this meeting, and we should be able to get the mock interviews up and going again. So for those of you who are still in that process, please keep practicing, because as Virginia said, you know, practice, 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 you become more comfortable with it. It will make the process more fun, and it'll make you have more confidence when you're talking with the PUIs, when they bring up an outside question or they sort of try to steer the conversation in a different way. You'll feel confident that you can work both with the app, the material, and the live person. So thanks again for your patience. It's been a really great 2 months trying to get here. And this is what it takes to launch something with an all-volunteer team that started from an idea. And now it's come to fruition. So thanks so much. I don't know if any of you guys have any questions or comments about that. So we will keep you posted. We'll let you know when we're going to restart up the mock interviews, but please keep practicing if you can. Thank you.
Do you have anything to add?
No, that's it. I'm good.
Oh, go ahead, Sean. Sorry. I see you now.
Obi, did you have something to add?
No, not at this moment. We're meeting at 3, so we'll talk more.
Okay. You know, one of the other things we were talking about was we kind of want to make people know that this is available. One of the things we've been able to learn over the past few weeks is that currently there is not a lot of coordination between the state and the municipalities. So, for example, as you know, the Miami mayor had announced that they were going to hire 1,000 contact tracers. I'm sure some of you heard that announcement a few weeks ago. Well, it turns out no one's been hired because basically the state basically told them that they have the authority to do that, and that statutorily, and that they're not going to allow the municipalities to handle it. It turns out that apparently the state is hiring some company to do some of their overflow. We've offered, I spoke to the State Surgeon General, and I offered our volunteers for this, and of course, they're all very grateful. I think the issue right now is that there's nobody knows how they're going to handle this, and this is what we come in, because I think we could start doing this while everybody gets their act together, or if they hire the people that need to hire, whatever it is that they need to do to make it happen. The bottom line is, like, right now, it's not, and you can see from the surveys that we can see now, is that it's not really happening. There's very little contact tracing going on. And so we have so many trained people. I think this is an opportunity for us to do that. But even issues as far as sharing of information, like, for example, whether the state may not share information with the county as far as who the positives are in the county, so that they can do the contact tracing. Because I think what the state wants to do is they want to basically control the contact tracing, and organize it, in one location, which kind of makes sense that you would want to centralize things. But at the same time, it kind of makes it difficult for us as such a big county that we are, and with the amount of positive cases in this area, that we want to protect our community too. So just so you know what's going on. So, one of the things we want to do is we want to start increasing awareness about the app and about the service. So since it's free, we could wait for the state to do it, but while we wait, I think, people can just use our service at no cost to them. And the worst thing that can happen is that we kind of done a lot of the background work for anybody that could come later. But as of now, there's very little contact tracing going on. And as we do this, I mean, this is a national project. There are people from different regions. You may find regions where the volunteers integrate with the team. Like in California, they have teams of volunteers that are integrated. Florida doesn't like that concept. I think they want to either hire people, or that's pretty much their position right now. So And there are pros and cons to everything. But at this point, I think what we need to concentrate on is just spreading the word, making sure the people that are positive know that they can use us and that they don't need permission from anybody to do that. And especially if nobody's calling them. We plan on Wednesday at 10 o'clock, we're gonna have this town hall meeting on like Facebook Live. So you guys are invited to come. The purpose of that is kind of like to start having these weekly town halls, not so much for us to talk amongst each other, but for the public to ask questions about what is it that we're doing, what is contact tracing? Why is it important? What does the app do? Because one of the issues we're having is that depending on which state you're at, there are different political views as to whether you need an app or not. There's this big emphasis out there on big government and whether people should have their geo position available or not. And I think these apps have been identified as a threat to security for people, as far as releasing their information to big government. So there's a lot of people in politics that are very concerned about the use of apps. Our app actually, the least it does is actually geolocate you. It's mostly so that complying with isolation or with quarantine. And it's mostly symptom reporting and creating rapport and setting you up to donate plasma and things of that sort. We're not really tracking people to see where they are so we can call them and alert the government or anything like that. But still, these apps just have, just so you know, politically, some people feel that there shouldn't be an app and that we shouldn't be having anybody's information and that we should protect confidentiality. So I think there's kind of a balance to play. But I think our app is actually perfect in that sense. If you don't want to be geolocated, you don't have to be. But you can take advantage of the fact that you can have someone that's actually calling you to make sure you're reporting your symptoms and you're short of breath. If you're short of breath, you can go to the hospital. Also, they can help you keep track of your positive test so that you can donate plasma. And we don't have to be watching this TV news saying every night that somebody's dying and they can't get plasma and they're looking for a donor. Hopefully that will be a thing of the past once we have enough. I think at this point we have plenty, but we could use more plasma. So that's pretty much my summary. Does anybody want to follow up?
Yeah, I'd like to say something.
You want to say something?
Yeah, so this is Sean. Welcome everybody again. So just want to keep in mind that there's going to be a second wave. Traditionally, epidemiologically speaking, we will witness a second curve. The second curve, as Dr. Jack mentioned, is on its way. How robust or how many populace will be affected by it is not known because this is a novel virus. We don't know anything about it. So even any type, and given that there's bureaucracies involved, things will take time, but the curve will not. The virus will not, and it doesn't care. So as long as we are staying focused and being steadfast, this is going to, even though we may not get large numbers in the beginning, we have to always be having the back of our mind that this is going to possibly erupt again, and then we will all be all hands on deck. So even though these bureaucracies are there, we have to just be patient because it's the only thing that's going to flatten the curve without vaccines, as everybody knows. And if we all just stay patient and stay focused, we're going to be most likely be utilized by anyone who's going to need contact tracing.
Good point. And Dr. Michelle, let me just expound on the confidentiality issue, because I'm sure many of you have that question, especially the new ones. We're not calling patients cold. We're not just picking up the phone and calling them. When they come through the Larkin drive-through or testing sites, they sign a waiver that a volunteer may call them to conduct contact tracing. They may not remember that, but I want you to know that they have signed something and given us permission to give them a call. So we're not just calling them and then asking for permission on the phone. We already have that. And it's in our documents that shows what it is that they have signed that you can remind them of. But I don't want you to feel that we're doing something that we're not supposed to be doing. All of these patients have given their consent.
Correct. And I think there's going to be a lot of learning. You're going to start seeing, like, one of the things that Larkin is doing right now is that we are actually offering a service to assisted living facilities and nursing homes. So we're actually sending somebody, because what's happening is there's not enough places to do the testing. And as you, I'm sure you've heard in the news, there's all these outbreaks happening in the nursing home. So what's happening is that they have this like SWAT team going into these facilities and randomly checking people, but not everybody's getting checked. And so the problem with that is if you just randomly check, you could easily miss. And this thing can pop up fairly quickly from just one person and spread out to a bunch of people. So what we're doing is that we're saying, we actually worked out an agreement with BioReference Labs. They actually have all the contracts with all the insurance companies. So they're going to be actually doing the billing with the third-party provider, not billing the nursing home. And except if the patient is on skilled care, which is a whole different story, because then they get paid for that. And then we're providing the tech that just does the swabbing. And we're doing that free of charge. We're not charging for that. We're letting BioReferences just doing the billing. So just the whole point is to just test more people. So the question is going to be, we might need a special session about how do you deal with someone that tested positive in a nursing home? How do you deal with somebody that tested positive in an ALF? You know, nursing homes probably have procedures in place as to what to do. But at ALFs, you know, they're 5-6 bed facilities. So there's going to be all different levels of apprehension as to, because, you know, unfortunately, what the state has been doing is they've been kind of just shutting them down. So they find that a lot of people are positive in a particular facility, they just take like aggressive action and they start like, you know, putting them on moratorium so they're afraid to report, they're afraid to do testing. And they're going to be very afraid if they get a phone call from somebody about contact tracing. So we need to be sensitive to that. But we'll deal with those issues as they arise. We're going to have different situations. We're also having large employers, you know, like 100-person employer. They're testing all their employees randomly. You know, they find one person that was positive, and now everybody's scared. So you're going to have different, I think there are going to be intricacies to the training process that we're going to be incorporating over time. Any questions?
This is not GS.
And that's one of the goals of the promotion is to not just to recruit volunteers, but we're also trying to reach those people who are positive, who don't know that we exist, and hope they will pick up the phone or go to the website or go to the app and register themselves so that they can be traced and so that their contacts may also be contacted. So there's 2 goals with the promotions. So we'll see how that works. Does anybody have any questions, comments, concerns that you want to raise here and now?
So maybe before we sign off, I just want to say, you know, I don't think there's any place in the United States or probably anywhere in the world where there's this many people that are working towards this. So I think you guys are an example. And hopefully this will be an example for other, you know, countries or other places where citizens can kind of take charge and take care of their own safety and not leave it all to the government. So I applaud you for taking the time to do this. I think Keith raised his hand.
Yes, Dr. Michelle and colleagues and others here. Thank you for inviting me to the Zoom. So far, I've taken the Johns Hopkins contact tracing course, and now I'm presently taking the ASTOS. So when I finish the ASTOS, I'll follow the steps and procedures as laid out on the site and also explained here as well. So I'm in the process. I should be finish the ASTOS before the week is out.
Excellent.
Thank you, Keith. We look forward to that. And you only have to take one. So I applaud your enthusiasm to do both of them. And many people have.
Yes. Thank you so much. Yes, I will. Thank you.
Thank you.
I'll go ahead and take the ASTOS. I've completed the Johns Hopkins, but thank you so much.
Great.
Ms. Johnson.
Dr. Michelle, one of the questions in the chat is, when do we think the second wave is expected to happen? Is this known?
Well, let me, I tried to pull the graph from this morning, which basically shows this, like, went up and then started to come down, and then they reopened, and now it seems like it's swinging up again. I'm not so sure that we're going to wait till the fall. I think we're looking at just, if you look at the last few days in the state of Florida, we've had over 1,000 positive cases consecutively. And, it's the statistics are very interesting. A lot of people say that's because there's more testing. But, I just think that it makes sense that as you reopen, that this is exactly when you need contact tracing, is when you reopen. Because obviously when everybody was quarantined at home, your job as a contact tracer is very simple, right? You shouldn't have been leaving your house because you were in quarantine. But now, asking somebody what they did the last 2 weeks is going to be complicated, because now they probably went to work. They probably went to the daycare to drop off their kid. Their kid may have come home with the disease from the daycare, who got, somebody was asking me the other day a question about whether daycares were safe. And I was saying, well, they might be safe for your kid, but how are these kids social distancing? They're not. So you could be assured that whoever else is in that daycare, all those families are sharing the same viruses, because it's just a matter of time. So yes, you can check the kids, you can check the staff, but how do you check each person that those kids get exposed to when they come home? So ultimately, you're going to bring something home. It's just a matter of time. So those are the issues that we're going to be facing, I think. And they're saying that it's going to be in the winter, towards the November, December. It all depends. If we get a major hurricane and everybody's sheltering, I can see how that could be a very good segue for this virus. So all these things that are happening now, if you look at all the protests where people are in close contact with each other, many not wearing masks. I don't know, did you guys see, there was a report of during the last pandemic 100 years ago, there was a very large protest that occurred because people were protesting the moratorium. They were protesting having to stay home. Obviously nothing to do with the current protests. No opinion on that, but I'm just saying this thing about going out in public without protection, when they're throwing tear gas and you're getting in contact with somebody else's secretions, that's all very worrisome for us from the standpoint of safety. So that's what we're dealing with, unfortunately, and I can see how this is going to remain a problem for the next year or more.
Can I address the question from the biostatistics of it? So the models that we have regarding a second curve or second wave or second upswing are based on obviously the 1918 pandemic. And what we know from those, the average time frame from the second curve, the beginning of the second curve was anywhere from 12 weeks from the zero date to 16 weeks after the zero date as well. So between this 12 to 16 week period, and possibly longer in some cities like San Francisco, was around 18 to 19, around almost 20 weeks for their second curve. And there's a lot of, everyone knows this is multifactorial, like Dr. Jack was talking about, things can mitigate in these rises or falls. So whether it's weather or the climate, and all this, we have this new factor, which is the protest, and a lot of people screaming, so they're transmitting a lot of the respiratory particles. So to answer that question, I think the best thing to do is you can go to National Geographic. They have a good historical charts regarding the numbers that I quoted. And I think the Washington Post also published something. So if you want to look at those models, you could look at that. But remember, these models are based on contact tracing from 1918. They're not based on vaccines and things like that, because they didn't exist for the first pandemic. So again, it can't be emphasized enough that what we're doing here is collecting the data from the patient, from the contact tracees, and utilizing that data to filter into the models that will be done in order to make predictions. Because right now, without the numbers, we can't make predictions. And this is why the virus is still considered very dangerous from the epidemiologic standpoint. So anywhere from 12 to 16 to 18 to 20 weeks, we should see this uptick. And we're starting to see them now. So this is the emerging threat that we're dealing with here. And remember, it's novel. We've never seen this virus before on this planet. We've never seen this illness associated with all the sequelae that are coagulopathies, neurologic effects, and things like that. So our function here is probably the most important function in the country right now for its safety and for the emerging threat.
You know, there's, as a result of the survey, just for you all to know, so I got this email from one of the people responding to the survey, and he says something like, and this is whole issue of antibody testing that you've heard about. They flooded the market with these antibody tests. You know, some of them are the blood tests where you take a blood sample, and the others are these fingerprint tests. The fingerprint one, the finger ones, like the ones that you do to check the blood sugar, are the most notoriously unreliable tests that they're out there in the market. Actually, the FDA has a warning against them, and it's basically it's like a pregnancy test. And then if it has 2 dots or if it has 3 dots, and then you determine whether maybe you have IgG, or it says nothing about anything. It doesn't say that you have the virus. It says that maybe you had the virus. You know, if the IgM is high, maybe it's acute. And if the IgG lights up, then maybe you had the virus before. It doesn't have to be this virus, could be any other virus. I mean, the whole thing is just crazy. So this particular patient responds in the comment section for our survey, the one that I just showed you earlier. And he said, "Oh, you guys lied to me. You said I was positive, but then I went to a doctor's office and they told me I was negative." So I said, would you mind sending me the result that said you were negative? Right? Because I didn't isolate, I just went and did whatever. So he sends me this letter from some GP's office with a copy of the fingerprint test. So I check his results, and with BioReference Labs, positive for COVID, PCR testing, which means he had the RNA from the virus in his nose. He didn't believe it, so he went to a doctor who did a fingerprint test, and that test apparently said negative. So he felt that meant that we lied and that he wasn't positive. So he's been going to work and, saying that. So even when I told him, look, that test is Mickey Mouse, you definitely had the virus, because there's no way that your nose can make that RNA. That RNA belongs to that virus. He still said, no, I think everybody's lying, and I don't think I ever had the disease. So this is what you're going to be encountering. I recently found out that the ambulatory surgical centers, like the places where you do plastic surgery, I know a friend that owns one, and we were talking, and she was saying she was doing testing, and I said, "Who's doing your testing?" And she said, "It's this company. They do the fingerprint test." I was like, "You realize that doesn't tell you anything, that you could be doing surgery on people that are positive." But this is what's going on. There's a lot of misconception out in the community, and I don't think there's a lot of public health people out there saying, "Look, if you want to know if you're positive or not, the only thing that can determine that is a PCR test, which is the one you take in your nose or in your throat. These fingerprint tests mean nothing, and you should not be relying on them to determine whether you're infectious or not." But that's the danger of what's going on out there.
Yeah. So we have another question in the chat, and I think it's for me. It asked about liability of contact tracers, and what you will, when you sign up for the app as a PUI, there is a disclaimer that they will agree to, and it specifically holds the contact tracers harmless, and that there is no liability on the part of the volunteer, and the PUIs agree to that when they use our app. So we have insulated, and there's also federal law and state law that protects us. So I think liability, what you have to do though is, those of you who are doctors, we are not giving medical advice. We are gathering information and helping to stop the spread. We are not giving any medical, I don't care, your instinct is to tell somebody how to treat something, or please take your medical hat off and put your contact tracer hat on. We're not giving medical advice. Anything else? Okay, I'm going to leave you with, for those of you who have not read the user guide, please look at the letter that Dr. Michelle wrote to all of you and all of us, and it will make you feel good and emphasize that what we're doing is a really good thing. And if the wave comes in 2 months, in 6 months, we are prepared. And we're going to be up and running shortly. Be patient with us. Practice, practice. Thank you all. And if you don't have any more questions or comments from anybody.
Thank you all. And
Bye.
Thank you. Have a great day.
Thank you.
Thank you.
Thank
Thank you very much. Have a great day. Thank you all.
Thank you, everyone. Thank you,
you.
Dr. Michelle and
Thank you.
everyone. Bye.
Thank you.
Bye. Thank you very much.
Thank you.
Have a good day.
Bye.
Bye.